So the therapy with Cipline and interleukin-2, it's used as a remission maintenance therapy for AML patients who have achieved a complete remission in response to induction and consolidation chemotherapy. So those patients are eligible to remission maintenance treatment with Cipline and IL-2. So it prolongs leukemia-free survival. It has been shown in a phase 3 trial. So myeloid cells, mature ones, they co-express the NOX2 enzyme and histamine type 2 receptors. And this drug, Cipline, binds to histamine type 2 receptors, and this inhibits the activity of the NOX2 enzyme so that less reactive oxygen species are formed. Antineoplastic effector cells such as NK cells and T cells, they are very sensitive to the toxic actions of reactive oxygen species. So Cipline makes the environment better for immune reactions, basically, because if there are less oxygen radicals in the environment, the NK cells and T cells, they function better, and they can also respond to stimulation via interleukin-2, which activates their cytotoxic activity. So that's the proposed mechanism of action for the combination therapy with Cipline and interleukin-2.